Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about insulin and glucagon. So basically, it is secreted by beta cells in the islets of Langerhans of pancreas. Its half-life is 5 minutes, and it occurs in synthesis. Usually occurs in the rough endoplasmic reticulum of the beta cells. So from pro-insulin is formed. Then there is peptide cleavage, and then insulin is formed. So basically, insulin is degraded in the liver and kidney by the cellular enzyme called insulin protease or degrading enzyme. So actions of insulin. So basically, it is involved in carbohydrate metabolism and regulation of blood glucose level, plus metabolism of protein and fat. So on carbohydrate metabolism, it is the only anti-diabetic hormone secreted in the body. It increases transport and uptake of glucose by cells and also increase the number of transporters, especially GLUT4 in the cell membrane. Also, it is transported into cells by sodium glucose symport pump. And when these receptor complex is formed in the membrane, then these GLUT4 are attracted towards the membrane and is released into the membrane also. So it also promotes peripheral utilization of glucose and also promotes storage of glucose, that is glycogenesis, and also promote conversion of glucose into, that is uh, glycogen. It inhibits the glycogenolysis, like it prevents the breakdown of glycogen into glucose in muscle and liver. It also inhibits the gluconeogenesis, means formation of glucose from proteins, by inhibiting release of amino acid from muscle and enzyme involved in gluconeogenesis. So this is on the carbohydrate metabolism. Then on protein metabolism, it facilitates the synthesis and storage of proteins and inhibit the cellular utilization of proteins. On fat metabolism, it stimulates the fat synthesis. So synthesis of fatty acids and triglycerides, glucose into fatty acids into triglycerides, and transport of fatty acids into adipose tissue plus storage of fat. So on growth, it promotes body growth by anabolic action of proteins. And next, regulation of insulin secretion. So when the blood glucose level is normal, that is 80 to 100 micro milligram per deciliter, then rate of insulin secretion is low. So when the level increases like 100 to 120, then its secretion rapidly rises, and if it rises more 200 or more than 200, then it rapidly rises. This is the diagram showing the structure of insulin receptor. So the bond is shown, like we are having the alpha unit, we are having the beta unit. So in both we are having this disulfide bond. There is also a biphasic effect of glucose. So when glucose level increases, definitely it increases after meal. So there is a release of insulin in blood rapidly. Within few minutes, concentration increases up to 100 from base level to of 10. It is because insulin release, which is stored in the pancreas, and within 10 to 15 minutes, blood in the concentration reduces to half, and after 15 to 20 minutes, again secretion rises once again. So it reaches a maximum between 2 to 2.5 hours, and prolonged increase is due to formation of new insulin molecules continuously from the pancreas. So the graph is also showing the changes in the plasma level of insulin after the meals. So we are having role of proteins, like excess amino acids in the blood also stimulated secretion, and beta keto acids like acetylate also increase its secretion. It is also increased by some hormones or gastrointestinal hormones like gastrin, secretin, and also enrolled in endocrine hormones like glucagon, growth hormone, cortisol. They also stimulate the insulin secretion indirectly. Then autonomic nervous system role, like if there is stimulation of parasympathetic nerve to pancreas, that is right vagus, then also its secretion increases. Next, we are having the glucagon. It is secreted from alpha cells in the islet of Langerhans of pancreas. Its half-life is 3 to 6 minutes. It is synthesized from pre-pro-hormone precursor called pre-pro-glucagon and then converted to pro-glucagon and then glucagon. And it is again degraded in the liver and kidney. And 50% circulating glucagon is degraded in the blood itself by some enzymes. Then actions are antagonistic to that of the insulin, like on carbohydrate metabolism, like increasing glycogenolysis in liver and releasing glucose from cells into blood. So it also increases the gluconeogenesis in liver. It also increases amino acid transport to liver cells for gluconeogenesis. It shows the lipolytic and ketogenic action actually. It increases the lipolysis by the it really means it releases the free fatty acids from adipose tissue. And there are some other actions like glucagon inhibit the action of gastric juice and the secretion of bile from liver. There are some role of other factors like factors which increase the glucagon secretion like exercise, stress, some hormones, and which inhibit the glucagon, somatostatin, insulin, free fatty acids, and ketones. Then, what is the mode of action of glucagon? So, basically, it combines with receptor and activate the adenyl cyclase via G protein, which further form the AMP and brings out the action. So, basically, it is secretion controlled by the glucose and amino acid level. So, when the blood glucose level decreases below 80, then these cells are stimulated and glucagon is released, which increase the blood glucose level. Also, the role of amino acid level in the blood. So, increase in amino acid in blood stimulate the secretion of this, and which in turn converts the amino acid into the